In our third episode of our clinical series podcast, we will be discussing the psychological aspect of diabetes management and its overall impact on the mental health of the patient. As we all know, people with diabetes are 2 to 3 times more likely to have depression than people without diabetes. An estimated 25 to 50% of people with diabetes who have depression remain undiagnosed and untreated. This patient who cannot cope with depression are more likely have difficulty in self-managing their disease. This will lead to the poor outcome of the diabetes management regardless of how advanced the treatment technology is, that is because diabetes is at the heart of a behavioral issue. Aside from depression, patient with diabetes has to deal with stress and anxiety issues. Based on the studies, patients with diabetes are 20% more likely than those without diabetes to have anxiety at some point in their life. That is because the long-term condition like diabetes is a major source of anxiety for some. Patients also find it stressful to deal with the demand to everyday diabetes care, thus affecting their ability for self-care. Being stressed by itself can affect the sugar levels. Stress hormones make sugar rise or fall unpredictably, and stress from being sick or injured can make the blood sugar go up. This overwhelming feelings can lead to diabetes distress that may cause the patient go back into unhealthy habits, stop checking their blood sugar, and even skip doctor's appointment. It usually happens to most people with diabetes after years of good management. An estimated 33 to 50% of people with diabetes have diabetes distress. How can we manage these psychological problems effectively? A simplistic approach to the problem of non-adherence should be avoided, considering that self-management of diabetes is complex, and that factors other than self-care can have a negative impact on glycemic control. First of all, there is a need to understand the cognitive, emotional, behavioral, and social factors involved in the process of diabetes self-management. This requires a comprehensive approach to diabetes and open communication between the doctor and the patient regarding adherence issues. How can one cope with anxiety? Number 1, getting active and doing some relaxation exercises like meditation or yoga can be calming. Number 2, interacting and communicating with friends who understands you can lower your stress level. Number 3, giving yourself time for relaxation. Take a break from whatever you are doing. Engage in outdoor activities that will help you recharge. Number 4, avoid drinking alcohol and caffeine, eat healthy food and get enough sleep. Number 5, make sure to have a regular follow-up checkup for your diabetic care. And lastly, ask your doctor to refer you to a mental health counselor to help you cope with your psychological issues. Thank you for listening to this podcast.